Congressman Perriello here. Congressman, I mean, this is great. Big thing's going to happen today, right?
Well, I would manage expectations if I were you. But
the greatest day ever in the history of Washington, right?
Well, we did our part to tee it up. I wrote a 2-page bill to get rid of the monopoly protections for the health insurance industry, just front and back of one page, and we passed it in the House yesterday with bipartisan support.
Now explain that. Are you getting rid of the what?
Of McCarran-Ferguson since 1945, the insurance
antitrust
industry
exemption for the health insurance, and that passed the House.
It passed the House. Over 150 Republicans supported it. Not John Boehner, but over 150 Republicans.
And by the way, can you explain? I think that's a great idea, because explain to me, because I don't get it. Why is it that since 1945, the health care insurance industry is the only industry other than Major League Baseball that's been allowed to price fix? They have an antitrust exemption. They can price fix.
It's the sort of thing that really only makes sense inside the Beltway. It doesn't make sense back home. If two plumbers in my district get together and they set prices, they're going to jail. But when the biggest health insurance companies in the country do it, it's seen as okay. Since 1945, it was sort of an early Ben Nelson compromise where it was supposed to be a 3-year exemption, and at the last second, they got rid of the phase-out. And ever since then, the industry has been spending hundreds of millions of dollars every year on lobbying to protect their monopoly.
Pat, could you explain, is there an economic justification for allowing price fixing among health care insurance companies?
I don't understand why there is, but you're talking 1945.
It's been since 45.
Overwhelmingly Democratic Congress went ahead and did this, which presumably would be very much in favor in those days of the little man in the middle class. Why would they do it?
Well, since 1945, you've had Republican Congresses, you've had Democratic Congresses. It doesn't take a whole lot. Again, it took 24 lines.
But opponents, you said Boehner was against this. What do opponents of this bill say?
Well,
why do they say that we need the health care insurance companies to have antitrust exemptions which allow them to fix prices?
Well, it was a tough argument to make, which is why you saw when it really came down to it yesterday, there were not a lot of folks who wanted to get up and make the debates. Well, traditionally, there had been issues about needing to share data in order to be able to have the information to set prices accurately. But there's always been a difference between sharing historical data and then doing projections and trend lines going forward. In other words, you want to know the probability that certain diseases and injuries are going to occur and how much those might cost. But that's very different than wanting to say, going forward, how can we agree on how much we should charge for this?
But
it was a simple bill. It was bipartisan support, and I think
great news.
That sets us off on a good tone.
That's great news.
A bill aimed at